Do I have PCOS or endometriosis?
Endometriosis and PCOS are two separate disorders.
Both affect your period and center on the ovaries.
Endometriosis is when the uterine lining invades the uterus and even the abdomen. Then you get internal bleeding every time you have a period.
That's why it is so painful.
When you have PCOS, there are cysts on the ovaries, interfering with their function.
It can create heavy periods.
But PCOS can also prevent ovulation, irregular periods and multiple egg releases. You might have trouble getting pregnant with PCOS, but end up with triplets.
I am not sure which is worse.
Endometriosis and PCOS are both sometimes treated with birth control pills to artificially get the body's hormones on a regular cycle.
And both interfere with your fertility.
Endometriosis affects your fertility like PCOS. However, pregnancy and breastfeeding are treatments of the sort, since it stops your menstrual cycle.
If it is really bad, you look at surrogacy as an option.
No, hysterectomy and removal of the ovaries, in some cases.
That throws you into menopause.
For a woman with bad PCOS, removal of the ovaries is an option as well.
What are the different symptoms between these disorders?
A woman with endometriosis may have diarrhea with her period. Women with PCOS are at increased risk of diabetes, hair loss and obesity.
What is the similarity?
Both disorders affect around 3 to 5% of women.
Yet I hardly hear of it.
Worse yet are the patients who have both. And yes, you can have both.
And both are rarely properly diagnosed by doctors.
That's where an endocrinologist is often needed to get a proper diagnosis of PCOS.
Yet another doctor in the hope of a proper diagnosis.
Don't give up hope. It sometimes takes years for a proper diagnosis.
That is not very helpful.